And with that, I will go ahead and turn it over to Lily Hungerland to get us started. Thanks again, everybody.
Great, thank you, Nick. My name is Lily Hungerland, and I am a teacher in Alta Vista, Virginia, a member of the Lynchburg chapter, and a member of the State Governing Board of Virginia Organizing. Virginia Organizing is a social justice organization, nonpartisan, that is committed to battling injustice across the state of Virginia. We do this through prioritizing empowering individuals in local communities to challenge injustice on a local, state, and national level. We're here today to both celebrate the 11th anniversary of the Affordable Care Act and the recent passage of the American Rescue Plan, as well as to discuss how we can close gaps in our healthcare system and make healthcare more affordable and accessible. I'll now pass it over to Sandra Cook, who is also on the State Governing Board, who will moderate the next section.
Thank you, Lily. Good afternoon, everyone. As Lily said, my name is Sandra Cook. I've been with Virginia Organizing since 2002. I presently serve on the State Governing Board as a member, and I'm also a member of the Richmond chapter. Today, I have the privilege of introducing our two speakers. The first one will be Jean Jackson, and Jean is from the Danville chapter. And Jean, take it away.
Sandra, I just got a note from Jean, and she may not be on right now. I think she's having some problems getting through, so we may want to go to Allison first. Sorry about that. Just found out.
Okay, Allison. Allison is our speaker for now, and Allison Powell is from the Harrisonburg chapter. Allison, take it away.
Thank you, Sandra. First of all, Senator, thank you so much for taking the time to meet with us today. My name is Allison Powell, and I'm a social worker here in Harrisonburg. When the pandemic hit, I was working full-time, providing behavioral counseling to school-age children and adolescents. When the governor shut down the schools, I was informed that day that my position was terminated with the company. Within a short time, though, I was fortunate to find another job in Harrisonburg. By taking this position, though, I lost almost $5,000 in income and all health benefits. I could have applied for COBRA, but that was going to be way more than I could afford since my husband had also lost his job. I attempted to apply for an ACA plan on my own, but with the uncertainty of my position due to it being grant and donor funded, I wasn't sure that I could afford the premiums of my income on my own and maintain my usual monthly expenses. Since then, my employer has found funding to provide assistance with getting an ACA plan. However, since I'm married, but I file my taxes separately, my monthly premium would have been over $500 and my deductible was $8,000. Even with my employer paying half of my monthly premium, I couldn't confidently say that I would have an extra $250 to pay each month for basic health coverage for just myself, and I never would be able to meet the deductible to take advantage of the copay benefits. Since losing my last job, I've not been able to go to the doctor to address my worsening back condition and have had to suck it up and take over-the-counter pain medication. Prior to this, I was going to the chiropractor at least monthly to address the bone spurs and misshapen vertebrae in my back. Due to the high monthly premiums and the ridiculous deductible, I've chosen to remain uninsured because of the continued financial burden it would put on my family each month. I want to recognize that the ACA has come a long way and has been a huge help to many people. My asks of you today, Senator, would be to one, continue to push for lower monthly premiums so more individuals can afford health coverage. And secondly, I ask that you look for ways to have ACA plans be more inclusive of other needs, such as dental and vision care. These are both areas that are vital to daily living for many people, and if neglected for too long, can lead to more serious health conditions later down the line. Thank you.
Thank you, Allison, for sharing your story with us today. The next person that will be speaking after myself will be Senator Kaine. I have the honor and privilege of introducing Senator Kaine. Senator Kaine was elected to the Senate in 2012. He first started when he was elected in 1994, serving as the city council, then mayor of Richmond. He became the lieutenant governor of Virginia in 2002. In 2002, and then he was inaugurated as Virginia's 70th governor in 2006. On a personal note, Senator Kaine, when he was governor of Virginia, appointed me to the Virginia Disability Commission in 2006, and I served for 8 years. Also, Senator Kaine and I are members of Leadership Metro Richmond. Senator Kaine completed the program in 1991, and I completed the program in 2003. And the last personal thing I'm going to say is Senator Kaine was born in the same year that I was born, and I'm not going to tell how old we are. Senator Kaine, please take it away.
Sandra, thank you so much, and especially for referencing your work on the Disability Commission and our work together as alums of the Leadership Metro Richmond program. I'm really happy to be with friends at the Virginia Organizing Project. I go to a church in Richmond, St. Elizabeth's Catholic Church, and we have a very strong member, Kathy Woodson, of our parish, who's kind of like one of the hearts of our parish, who's really active in the organizing project. So I always enjoyed dialogue with VOP folks from around the state. And the real good part of this is going to be questions and answers and me getting your advice. But let me just talk for a few minutes, because the stories that you've told about your own healthcare situations, Allison, you and your husband, and grappling with health needs and high premium costs, and everyone on the call probably has some challenges in this area because we live in a society that doesn't make healthcare a right. I want to talk a little bit about the 11th anniversary of the Affordable Care Act and what we just did in the American Recovery Plan, maybe Allison, to address some of the issues that you raised, and then we'll open it up, and I'd be very happy to take questions and take your advice. I am a member in the Senate of the Health, Education, Labor, Pension Committee and the Budget Committee, and those two committees do a lot of work on healthcare policy, and we're going to do more. So first, this is a good day to celebrate the signing of the Affordable Care Act. When it was signed, I was the chairman of the Democratic National Committee and worked with President Obama at the time all around the country to encourage members of Congress to vote for it. And I will always feel about that work that I was chairman of the party at the time we did something really important for Americans, expanding healthcare coverage. The percentage of uninsured Americans went down dramatically, and premium growth also, even though it's still too much for many, premium growth and the medical cost growth also slowed down. We have a lot more to do, but I want to thank many of you because you were helpful in getting the Affordable Care Act passed in 2010. You were helpful in making sure that Virginia embraced Medicaid expansion. That was an important priority of the Virginia Organizing Project. And that decision by the Virginia General Assembly meant that more than 400,000 Virginians, many of whom didn't even ever have health insurance before, now have health insurance because of your efforts. And finally, when there was an existential vote in August of 2017 in the United States Senate to eliminate the Affordable Care Act, to repeal Obamacare and take health insurance away from more than 20 million Americans. Many of you helped us save the Affordable Care Act by a 1-vote margin. It was one of the most dramatic moments of my life when we were having the vote in the Senate at about 2 a.m. And by 1 vote, we saved healthcare for millions and millions of people. So thank you for what's been in the rearview mirror, your support for expansion of healthcare. When we passed the when we passed the American Rescue Plan a few weeks ago, we took some significant steps forward to strengthen the Affordable Care Act. And I want to talk about those, and then I want to talk about an additional step that I'm trying to get my colleagues to take. Allison shared the fact that for many, even with the subsidies under the Affordable Care Act, policies on the exchange are still too costly for many. We just significantly increased the subsidies that Americans can get if you are between 100% and 400% of the federal poverty level. The subsidies that you can get to bring down the cost of the premiums for a policy that you would buy in the exchange, we just agreed to dramatically increase them. So to Allison and others who have had to go without, you might want to check soon, and you should be able to see that the tax credits have increased, which should make the premiums more affordable. In addition, we took another major step, which is if your income is more than 400% of the federal poverty level, we have put a cap on your premium. No one should have to pay a premium that is more than 8.5% of their income. And if you can't find a policy whose premium is less than that, then you can use a tax credit to bring the premium down, even if you're making more than 400% of the federal poverty level. So those are two recent changes that should help more people be able to afford to buy health insurance on the exchange. I know those two provisions very well because they're part of a bill that I have introduced with Michael Bennett of Colorado called Medicare X. And it's the next step forward that I hope we will take in providing health insurance to more Americans. And it's basically a bill that would create a public option insurance policy. We would direct the Centers for Medicaid and Medicare Services, CMS, to develop a policy that would cover all of the Obamacare essential health benefits and offer that policy on the exchange everywhere in the United States, both to individuals and also to small businesses. If you qualify for an Obamacare subsidy, the tax credit, you could use that tax credit to even bring down the premium on the public option significantly. Because the public plan offered by CMS does not have to cover a profit margin, pay fancy salaries to executives, doesn't have to advertise on the evening news or pay state and local and federal taxes, that premium should be very reasonable. And then if you apply the tax subsidy to it, it's even more reasonable. So we think that is going to be the next step that will enable people to get insurance. And one of the benefits of it is we're a very mobile society. And so it's pretty common that people move to different cities or different states because of marriage or to go to school or to take a new job or to find new opportunities. You don't know when you move whether the insurance company that is writing your policy here writes policies in another state. But CMS writes policies in every zip code in the United States. And so not only do we think it would be affordable and convenient and comprehensive, we also think these CMS public option policies would be very portable, and you could move anywhere in the US with the confidence that you would still be able to keep your policy. This is the next step forward that we hope to take. We also included in the American Recovery Plan some additional funding for COBRA policies. Allison mentioned that COBRA is too expensive, and for many it is. If you leave one job before you get the next job, you don't have an employer paying part of the premium. The full ride on the premium is very expensive. I know that because I once had to pay the full premium, COBRA premium, a few years ago when I left one job before I could take another. But in the American Recovery Plan, we include resources to help Americans who have lost jobs during the crisis so they can better afford COBRA coverage. But I will say that the most significant thing that we now need to do, having passed and protected the Affordable Care Act, having expanded Medicaid in Virginia, having passed an American Rescue Plan that will lower premium costs because of increased tax subsidies. The next thing we need to do is to offer a nonprofit insurance policy that would be a reasonably priced option for every American family. And that's what I'm working on now. And then last, before we open it up, I am very glad, and I will rely on Nick and to maybe manage the Q&A. But if someone asks a question in Spanish, I can answer it in Spanish. I'll speak in whatever language the questioner prefers. And my Spanish is not perfect, but I think I can be understood well. And with both Tamiko and my staffer Gaston on the call, if I commit an egregious error, there are people here who can correct me.
Well, thank you for sharing, Senator Kaine. We appreciate all of the information that you have given us thus far. We do have a few questions planned, but if others have a question for Senator Kaine, you can message those to Brian Johns. Okay. When I call on you to answer your, ask your question, if you don't mind shortly introducing yourself and trying to ask the question in around a minute, that would be great. So first up, we have Laverne Jackson from the Newport News chapter. Go ahead, Laverne.
Good afternoon, Senator Kaine. Thank you for meeting with us. I appreciate the work that you've done in healthcare and your work on the ACA. I'm a retired pediatric and critical care nurse, and my concern is about those people who have employee-based healthcare offered, but a lot of times can't afford their share of the premium, yet the portion that the healthcare employer provides is counted as part of their salary. I work with many nurses who, either because they were single or part-time, couldn't afford healthcare in the hospital they were working at, yet their hourly rate didn't increase because they didn't take the healthcare. And I wonder if you had any thoughts or ideas on that.
Laverne, that's a very good point. And I haven't really thought through the dimensions of the question that you asked. So I'm understanding if you're working and you're getting paid a salary and you have a healthcare benefit, but you can't afford the employee portion of that benefit.
Right.
So you choose not to take it, but then you don't get what the employer would have been willing to pay as part of your salary. And so you're essentially working the same job as maybe the person next to you, but you're essentially getting paid less. I think but as you describe it, it's an injustice. I think the way to deal with that is to try to create options that are more affordable for people, so that no one in that situation would have to make the choice of, I'm glad I have an offer of healthcare, but I can't afford it. I think what we need to do is figure out ways to reduce the burden on someone. There might be things we can do with respect to purchasing insurance on the exchanges, especially if we could do this public option that will become more affordable for employees like those you described. But I have some staffers on this call, Gaston Arose, I think Corinne Charles Dungo and Katie Wright might be on. We're going to take that concern that you expressed and see if there's a way we can factor that into future work that we do in healthcare. It is very likely that the next bill that the Biden administration wants to do, an economic recovery bill, is going to contain significant additional healthcare reforms. So I will try to see if we can come up with a creative way to address that one. But the bottom line is we just need more affordable premiums. And if we can find more affordable premiums, then fewer people will be in that painful situation you describe.
Thank you.
Thank you.
Next, we have Dustin Robbins from New River Valley chapter.
Everyone hear me all right?
Hey, Dustin.
All right. So, I'm just going to read what I was going to ask up. While many people are focusing on the current worldwide pandemic that thankfully is getting some relief with multiple vaccines, and of course the ARP that was passed a few weeks ago, many doctors, insurance companies, and even lawmakers are ignoring a huge problem that's also in this country related to healthcare. I myself am a type 1 diabetic with possible heart conditions such as angina, which my doctor is trying to currently help me with. Private corporations simply won't pay that are insurance companies for quite a lot of the equipment and medications required to simply stay alive with other epidemics that are just in this country, like diabetes or even HIV/AIDS. So I'm curious, even though they're making these billions of dollars off of us with no real attempts to try to find cures for them, how can we help convince them that they need to, so that they can, you know, ease the burden off of Americans and not just profit off of us?
Dustin, I'm glad your question is extremely well timed, because we had a hearing in the Health Committee this morning on the price of prescription drugs in the United States. And a lot of the focus of the hearing was on insulin. So I know you're asking a broader question than just diabetes, for example, but and you're also asking a question that's broader than just the prices of prescription drugs. But it turns out that we just paid dramatically more for prescription drugs than virtually any country in the world. And we had powerful testimony in the committee this morning from a woman in northern Vermont who lives about 5 miles away from family members in Canada. And the difference in what she and her family members on the other side of the border pay for insulin, it just is sickening. It's sickening. And it is somewhat about greed of the companies, but frankly, it's more about poor public policy. We should be doing in the United States what nations like Canada and other nations do to bring down the cost of prescription drugs. Instead, we have had policies that, frankly, Congress in the past has allowed policies to occur that do not focus on trying to make insulin affordable, for example. We had the hearing this morning precisely to choose strategies that we can use and put in place legislatively so that we can actually start saving people money as they need to buy insulin or other life-saving drugs. And I actually feel pretty confident that both the Biden administration and the new Democratic majority in the Senate will work to pass some of these bills that will put appropriate limitations in place so that treatments, cures, prescription drugs will be dramatically more affordable. I look forward to, I've told you we're going to do it, so you should hold me accountable to what I've said. And, 6 months or a year from now, let's come back and see whether we in fact have done that. But I do know that that is the intent of the new Senate majority.
Well, that's all very good to hear from what you just said. I didn't know about that hearing, but I would like to hear more going forward, and I'm sure everyone else would. Because I myself have had to pay hundreds of dollars a month on insulin until Virginia decided to put that $50 cap on it. And I know it's a good selling topic because insulin is the biggest epidemic in the United States.
Right.
But other than that, I thank you for your response, and like to see if everyone else has questions.
Thank you, Dustin.
Next, we'll turn to Karen Downing from the Eastern Shore chapter. Go ahead, Karen.
Thank you, Lily. Good afternoon, Senator Kaine. I am Karen Downing from the Eastern Shore chapter, living specifically in Accomack County. I am considered an older American and have multiple chronic medical diagnoses that require prescription medications. I'm also on an infusion biologic and have medical devices. So I have 10 or more of what are considered to be pre-existing type conditions. And I'm very concerned with the accessibility and affordability of medical care and prescription drugs. The nation's 664 billionaires have now increased their combined wealth by $1.3 trillion in this first year of the pandemic, as families have struggled, workers have lost their jobs, and small businesses have closed. How will you work with Congress to make the ultra-rich billionaires and the corporations they may represent pay their fair share through taxation to fund investments in healthcare and other programs for the country to build back better?
Karen, thank you for your question and just for sharing the health challenges you deal with. I spend a good bit of time on the Eastern Shore, and in particular, in my most recent visit, I was at the Federal Health Center, Eastern Shore Rural Health, which has opened this new facility that you may be aware of that I was really impressed by.
Yes.
Your question is really though about tax policy. So what about tax policy? We made in my view, a fundamental mistake, and I worked against it and voted against it when we gave tax cuts to the wealthiest in 2017, in December of 2017. That was the signature legislative achievement of the Trump administration. But in my view, it was not an achievement. It was something that really was harmful. 65% of the benefit of that tax cut went to the 20% of Americans who are the highest earners and the wealthiest. And only 1% of the benefit of that tax cut went to the lowest 20% of American workers, low income and folks who weren't wealthy. So that tax cut bill was overwhelmingly for the richest. I was excited about the American Recovery Plan because we spread the benefits out pretty significantly, except at the top. It was not a bill that benefited the top 20% of earners. And in fact, the biggest winners in the American Recovery Plan were the lowest 20% of American earners. But I do think we still have a need to go back and write the tax code in the way that you stated. I believe that when President Biden and Vice President Harris announced the economic recovery bill that will include infrastructure, that's likely to include some of the healthcare reforms we're talking about, and maybe some workforce development priorities, I think you'll likely see that they will propose to fund at least a portion of that by restoring some of the taxes on the highest earning American individuals and corporations. And I think that that's important because I think the tax cut bill of 2017 was frankly a giveaway to the wealthiest at a time when they weren't the ones that needed help. And so I was, strongly opposed to it, and I will be strongly in support of a tax code that is that puts more of a burden on the shoulders of those who can afford it. I'll say one other thing about tax reform, because it's not yet clear how comprehensive the effort will be to do tax reform. But if I was the sole drafter of the tax bill, it's not even a question of what the tax rates are in the individual income tax. We tax wages and salaries a lot higher than we tax investment earnings. And so wealthy people tend to put they tend to make income and structure their transactions so that they're making income through sources of income other than wages and salary. Might be dividends, might be carried interest, might be capital gains. And the tax rates on those kinds of income are a lot less than they are in wages and salaries. So if we just tax things like capital gains and dividends and interest and carried interest at the same rate as regular income, wealthy people would pay a lot more in taxes. They basically get a little bit of a tax shelter because they earn their income in ways other than wages and salary. So I wish we would move to a way of thinking about income in this country that $1 is $1, and you're going to pay the same tax rate on it, whether it's a wage or salary or carried interest or capital gains or dividends or interest. And if we did that, the system would be much more equitable, and we would not allow wealthy people to essentially have a lower tax rate than working people.
Thank you, Senator Kaine. And we look forward to the work that you and the Congress will do in reforming the tax code. Thank you.
Thank you, Karen.
Great. Next up, we have Patrice Smallwood from the Norfolk chapter. Go ahead, Patrice.
Thank you, Lily. Good afternoon, Senator Kaine.
Hello,
thank you
Patrice.
for being here with us and for taking the time to answer our questions and for all the work that you've done for our state. Virginia is at the bottom of all the states when we look at vaccine distribution. And even within our state, the Hampton Roads area, which has those cities which have the largest and the highest population, it seems that they are the last in moving into the phases. And so my question to you is, what efforts are being done and what do you recommend that we could also do to ensure that Virginia, our state, and even in particular Hampton Roads cities receive an equitable distribution of the vaccines for our residents, and even more so our vulnerable populations as we continue to move throughout the phases of the vaccine distribution?
Patrice, thank you for asking that question. And I know from the congressional side how much money Congress has put into vaccines in the last year, and that money is being allocated to states. And I want to maybe give you a little bit of an update on how Virginia is doing, but I'd like to continue to dialogue because I'm going to give you statistics that are now a few weeks old, and maybe my statistics aren't current. It was the case at the beginning of vaccine distribution in January, say, and maybe even into early February, that Virginia was one of the lowest states in the country. You would see the percentage of vaccine that Virginia had been given that had actually been used. We were often like 45th out of 50 states. We were very, very low. One of the reasons for that was actually, it wasn't Virginia's fault. It was more lack of guidance from the previous administration. Until recently, all the vaccines have been 2-dose vaccines. So now we have a 1-dose vaccine, thank goodness. But initially, when Virginia was getting the 2-dose vaccines, they were not getting very good guidance from the previous administration about when they would get the next shipment of doses. And so what Virginia was doing was only administering half of the doses and saving the rest of the doses in the freezer to make sure that they would have enough to do the second dose. When the new administration came in late January, they dramatically ramped up production of the vaccines, and they were able to tell everyone, you don't need to save second doses in the refrigerator, just go ahead and give them all out, and then there will be enough for the second doses. And within a pretty short period of time, Virginia went from 45th to about 11th or 12th in the country. The federal delegation has a phone conversation with Governor Northam and his cabinet about every 2 weeks where we ask, how are you doing on vaccine? Are you getting enough? Are you deploying? And I think Virginia has dramatically improved because we're giving, the federal government is giving Virginia better guidance. And now the quantity of vaccine that's being distributed is dramatically rising. But you are right, Patrice, even today, there's significant regional variations. The regional variations, I have been visiting vaccine clinics in, city of Roanoke, but also in rural King George County, public housing communities. And there is a real variation in terms of the equity, not only with how vaccines are being distributed, but who has time to sit on their computer and sign up for to register to get a vaccine? If you're home all day, maybe you can do it. But what if you're working all day? You don't have the chance to sit and hit refresh over and over and over again until you can get registered for a vaccine. So we do need to do affirmative outreach, both into regions, but also into hard-hit groups of people, seniors. If we know that African Americans and Latinos are getting COVID more than Caucasians and dying of COVID more than Caucasians, then we need to be doing specific outreach to the hardest hit communities. There's some parts of rural Virginia where we just have not penetrated very much into the vaccine challenge. So I think we now have a supply that is adequate and getting better, but where we still have work to do is affirmatively going out to communities that hit the hardest by COVID and giving them convenient and easy options to get vaccinated.
Great, thank you for that update. I think part of us being able to resolve the problems is first identifying what they are. And so I'm grateful that you're able to give us the updates and explain that to us more clearly.
And Patrice, you can be sure that when we next have this conversation with Governor Northam, we tend to do them on maybe every other Thursday. We will ask the question about, where Virginia ranks in the country, but also about how equitably are we doing the distribution.
Thank you.
Thank you so much, Senator Kaine. Now we will turn back to Sandra Cook.
Thank you so much, Senator Kaine, for spending time with us and sharing the information. We've met with you numerous times over decades, and again today, we want to thank you for everything that you've done. We also would like to thank all of our speakers today and the people who asked questions and everybody who was in on this call. We wouldn't be Virginia Organizing, though, if we didn't ask you to do something. And before we end this call today, we would like for everyone to call their member of Congress and ask them to support making permanent improvements in healthcare. And the way we want you to do it, I'm going to give you the number to the Capitol switchboard, and then you can call this number and then ask them to connect you to your representative. The number for the Capitol switchboard is 202-224-3121. It is in the chat room, but I will repeat it, 202-224-3121. I ask everyone to take time out of their schedule to contact the switchboard asking for their representative to support making permanent improvements. We want to make sure we put that in the healthcare system. And before we end this call, Senator Kaine, is there anything that you would like to add to what you've discussed today?
Sandra, let me just thank you for the invitation to be with you. And let me underline what Sandra said about permanent improvements. Remember that I told you that the American Rescue Plan improved the tax credit so that you can buy health insurance on the exchange, and it's more affordable if you're in the 100 to 400% of the federal poverty level, and it even caps your premium over 400%. But the American Rescue Plan only did that for 2 years, so it's not permanent. It's a 2-year improvement. And so when Sandra says, call and ask that we make permanent improvements, that's really important. We just did some very good things, but some of them are temporary, and we're going to have to figure out how to make them permanent. So Sandra, I just think the way that you phrased the lobbying ask is an important one. We did some good stuff, but we have to make that permanent.
Okay, thank you again. Any other questions? Any other comments? Go make the phone calls.
Thank you so much, Virginia Organizing.
Thank you, everybody. Have a great day.
Thank you, everybody.
Thank you, everybody.
Thanks. Have a good
Bye,
one.
everybody.
Thank you.
Everyone.